Hello, I'm Catherine D. Henry, subject matter expert and Senior Vice President for Web3 and Metaverse at MediaMonks. This morning, I got back from doing a great cardio workout at the Great Wall of China and along the Sibang Phai River in Laos and high up in the Redizat Mountains in Romania. No, I don't have a private jet. What I do have is a supernatural fitness app for my MetaQuest VR headset. It not only gets my heart pumping, but it also takes me to some of the most beautiful locations in the world. All of which is to say, it's time to talk about health in the metaverse. Now, when I say that, you might be picturing a virtual doctor sitting in front of you conducting your annual exam. The truth is, there are some interactions that we need to keep doing in the physical world. I mean, how else would your digital doctor hit you on the knee with that little rubber mallet to test your reflexes? When we talk about health in the metaverse, we're focused not on replicating the physical world interactions, but on the ways in which technology can bring people together and help them live their healthiest lives. Let's talk about ways we can do this. For many negative health outcomes, prevention is key. For example, according to the World Health Organization, hypertension, or high blood pressure, is the #1 risk factor for death around the world. To prevent hypertension, we can do things like be physically active, not smoke, limit our alcohol consumption, and get enough sleep. So, how can the metaverse help us with that? Diagnostics that once took place only in the doctor's office have moved into and will continue to be developed in the metaverse. Did you know that, according to the National Library of Medicine, snoring is a predictor of hypertension among middle-aged adults? A smartwatch can tell you if you're snoring at night, and you can then share that data with your physician. As the metaverse evolves, many more sensors, products, and tools will be developed that help us to live healthier lives. Now, while it existed to some degree before, when the global pandemic prevented us from keeping in-person appointments, telemedicine really took off. And sure, talking with my doctor over video was great, but I can't help but think of how much richer an experience like that could have been in the metaverse. As I mentioned before, my doctor can't test my reflexes or wrap my sprained ankle in VR, but there is a lot of potential for medical meetups in the metaverse. In the fully realized metaverse, my avatar and my doctor's avatar might meet in a virtual clinic room. Using AR, a hologram of my doctor might visit me at my home where I can show them my medications and we can talk about the importance of taking them on a regular schedule. Caring for our mental, emotional, and social health is just as important to our well-being as caring for our bodies. It can be hard to ask for help and harder still to engage with mental health services. Virtual sessions where you can attend as an avatar, including group therapy, might help to lessen anxiety and discomfort. Examples of metaverse mental health services include the virtual clinics offered by VX Health and Amelia Virtual Care, the VR platforms for professionals. The metaverse might also give people the opportunity to self-organize into supportive communities, much like we find groups relevant to our needs and interests online today. You might belong to a support group for diabetes, cancer, fertility, anxiety, grief. The list goes on. But because we will be embodied and co-present in metaverse spaces, our interactions will be so much richer and feel more interactive than they do through online chatting or video meetings, giving us a new avenue for robust community support. Oh, and remember my adventures around the globe at the beginning of the video? The metaverse is an awesome way to increase physical activity and incorporate fitness into our lives in new and exciting ways. And apps like HoloFit and VZFit allow you to see virtual worlds while you use your home exercise equipment like rowing machines, ellipticals, and stationary bikes. If cardio isn't up your alley, how about a meditation app like Trip or guided meditation VR? As we look to a future that includes more ways to monitor and augment health through technology, it's important that we consider the economic implications. How do we ensure that metaverse health interventions and applications are equitable and accessible? This is a question that healthcare professionals are thinking about all the time in the physical world. After all, according to the Centers for Disease Control, there's a 6.5-year life expectancy difference for someone living in California versus someone in Mississippi. A report from the Brookings Institution indicates that positive health outcomes are tied to higher incomes. This is especially relevant for the metaverse, because we know that not everyone has access to or the means to obtain digital devices. Coming up next, we're going to step away from the personal and focus on something bigger than us. Get ready for architecture in the metaverse.